Hello friends, welcome back to my YouTube channel. So in today's video we are going to see yet another topic in toxicology, that is carbon monoxide poisoning. So carbon monoxide poisoning is going to be discussed under 7 topics, that is definition, mechanism of action, signs and symptoms, fatal dose and fatal period, treatment, postmortem findings and medico-legal aspects. So first let us see about the introduction. So carbon monoxide is commonly known as an asphyxiant. What do we mean by asphyxiant is that asphyxiant is a substance that causes asphyxia. So asphyxia is defective aeration of blood causing pulselessness. So how does it cause pulselessness? By interacting with the O2 and CO2 exchange within the body. So when we breathe, O2 is inhaled and CO2 will be exhaled. So this asphyxiants, these interfere with this O2 and CO2 exchange, causing pulselessness and defective aeration of blood. So asphyxia is defective aeration of blood or pulselessness, absence of pulse due to interference in the O2 and CO2 exchange in the body. So this is the thing. So this O2 and CO2 exchange when we breathe is interfered by the CO, carbon monoxide, and this carbon monoxide is known to have 250 times more affinity to hemoglobin when compared to oxygen. So normally the oxygen which we breathe in, it combines with Hb, that is hemoglobin, and it forms HbO2, that is oxyhemoglobin compound. But this CO, it is known to have 250 times more affinity than oxygen. So when oxygen and CO both are present in an environment, O2 obviously combines with hemoglobin and forms carboxyhemoglobin compound. So this compound is formed because though oxygen is present in the environment, CO, that is carbon monoxide, is known to have 250 times more affinity than oxygen. That's why carbon monoxide compound is formed along with hemoglobin. So this compound is called carboxyhemoglobin. Normally oxyhemoglobin is formed in normal conditions, that is in our bodies, but when an environment has excess amount of carbon monoxide, the compound which is formed is carboxyhemoglobin. So next let us see the mechanism of action. So we already said that normally hemoglobin binds with oxygen forming oxyhemoglobin compound. This is in normal individuals, but in carbon monoxide poisoning, that is when excess amount of carbon monoxide is present in the environment, though oxygen is present in the environment, hemoglobin is seen to bind with carbon monoxide forming HbCO, and this component is called carboxyhemoglobin. It's very toxic to our body. So next let us see about the signs and symptoms. So the signs and symptoms depends on two things, that is duration of exposure and levels of carboxyhemoglobin. So this carboxyhemoglobin, we said this is a compound formed in blood instead of oxygen being binded. So this the level of carboxyhemoglobin in the blood and the duration of exposure, two things only determines the signs and symptoms of the patient. So when the level of carboxyhemoglobin in blood, this is in blood, when it is below 10%, the person might not have any symptoms, that is asymptomatic. When it is between 10 to 20%, there might be mild headache, that is difficulty, this mild headache, since at any condition you can have mild headache, it is very difficult to identify that this headache is only due to poisoning. You cannot find it out like that. Next is 10 to 30%, when the level of carboxyhemoglobin in blood is between 10 to 30%. The person might present with emotional instability, irritability and severe headache. 30 to 40% confusion and ataxia. 40 to 50% increased confusion, incoordination, tremors. This increased confusion and incoordination resembles with drunkenness. So alcoholic person, it resembles with alcoholic person, And one more classical feature that is present only in carbon monoxide poisoning is that cherry red discoloration of skin. This term is very very important because it is a classical feature of carbon monoxide poisoning. So cherry red discoloration of skin will be seen, and memory loss in 40 to 50% of carboxyhemoglobin present in blood. Next is 50 to 60%. The person might present with arrhythmia, seizures, and MI, myocardial infarction. And above 60%, there must be coma and death. Next, let us see about fatal dose and period. So, the concentration of carbon monoxide and fatality. So the concentration, when it is between 0.2, the fatality is within 4 hours of exposure, and then 0.4 concentration, the fatality is between 1 hour, and when the concentration is 10, the fatality is within half an hour. Next, let us see about the treatment. So the treatment, the first thing you should do is that removal from the source of exposure. Remove the person from the source of exposure and immediately administer him with high flow oxygen, that is orthoboric oxygen. What do you mean by orthoboric oxygen is that high concentration of oxygen, like 100% of oxygen. The concentration of oxygen is like to the fullest. The gas only contains oxygen, like that. And the second thing is blood transfusion, because we already said that all this condition is caused due to HbCO, that is carboxyhemoglobin. And then third thing is gastric lavage. Fourth thing is cerebral edema, which is caused due to in severe concentrations of carboxyhemoglobin, cerebral edema is caused, and that can be treated by mannitol, 500 ml IV and 5% dextrose. And fifth thing is antibiotic and symptomatic treatment is given. Like whatever the symptoms the patient has, symptomatic approach should be given. Next, let us see about the postmortem findings. So the postmortem findings is always divided into external and internal findings. In external findings, we already said that cherry red discoloration, this is a very important feature of carbon monoxide poisoning. This is seen in skin and mucous membrane and internal organs also. Next is fine froth from nose, blisters on skin on dependent areas due to cutaneous edema. All these are external features. Next, let us see about the internal features. So the lung, edema and congestion is seen. In heart, lesions vary from petechial hemorrhage. CNS, neuronal hypoxia injury, hemorrhage and softening of cerebral cortex. Next, let us see to the final part of the video, that is medico-legal aspects. Always try to end your answer with medico-legal aspects. It will fetch you more marks. So in medico-legal aspects, this carbon monoxide poisoning is a common mode of suicidal poisoning in China. So it's not in India. It is common mode of suicidal poisoning in China. In India, accidental poisoning is more common than suicidal. Next thing is carbon monoxide and hemoglobin, that is carboxyhemoglobin compound, can even be detected in putrefied or embalmed body, because in putrefaction certain components are formed, but carboxyhemoglobin is never formed. So the moment you find this in a body, in a sample, it clearly shows that the patient had died only due to carbon monoxide poisoning, because it is never a component of putrefaction. So with this, I end today's video. Thank you so much guys for watching. If you like this video, consider subscribing the channel for more such videos. Thank you.